Hey guys, this is Richard Ogachi again. I'm back again tonight. Thank you guys for subscribing to my YouTube channel. I'm sure that these kind of conversations that we are sharing are going to be interesting, and of course, have fun out here and be all we can be and do all we should do. So tonight, remember you guys, I'm a registered nurse, 16 years experience, 16 years of doing nursing as my job, and now transitioned from to a different country. I live in the US. I'm from Kenya, and I wanted to share experiences about healthcare in Kenya. And on this time, excuse me, I'm gonna talk about healthcare in the lowest facilities, primary health facilities that are giving services to people, and how the whole concept of paying bills comes along with getting the service that you're looking for. So, as I said, 95% of people, more than 95% of people in Kenya access healthcare from public health facilities. That means that, and the reason for that is most people don't have health insurances. So there's a very nice, good program called fund called it was called NHIF before, and now it's SHA, SHA, and that is a program where people pay some money to the government as membership, and then they are able to access whichever services they're looking for. Excuse me. So the lowest facilities are level 2 and 3. This is mostly dispensaries and health centers. So I don't want to talk about government now in this case, because there are other smaller facilities, that's clinics that serve that kind of people, but they charge some money to be able to offer the services. I've been involved in establishing a couple of such, and I understand the dynamics around attending to people in those clinics, especially people who don't have insurance and they have to pay cash before they can access the service. So one of the observations that I made is that those kind of clinics, especially private, they're privately owned, and this privately owned below level 3B, they are owned mostly by nurses and clinical officers. And then also there are people who also go for it, and they are not healthcare workers. There are many who are doing it as business. And then there are different ones, a chain of those that are owned by a conglomerate or big companies that they're able to raise funds to establish different ones, a chain in different cities, same having like a social franchise model. But so those ones, they also address or target these kind of populations. Some also, like well branded and nice ones in good cities where people have income, they are able to get the insurance companies also to pay for these clients or for these patients. So one thing you notice in these facilities, small ones, is most people don't have money to pay. So the clinic, they have a record, because some people come and it's an emergency. Some people go to these facilities in an emergency situation. they don't have money to pay, but you have to see them. You know, sometimes it's you can't turn them away. Or maybe the patient has been going to that clinic, and they don't have money to pay at that time, and they have a promise that they'll be able to get money in a couple of days or in a couple of weeks. You know, some of those clients who've been paying and now they have a challenge to pay, you always don't turn them away. So in small clinics, you end up with a list of patients with their money balances. So I've seen a couple of people who have just outpatient clinics. They have a bunch of booklets having patients' names and the amount paid and amount they're owing. You find when you look at that situation now, and also now like compare it with what happens in the US. In this particular situation, the US, no patient is turned away. We turn patients away in Kenya all the time, because if they have to know who is going to pay, who is going to shoulder the bill, who is going to take care of the bill, you know. Otherwise, you know, some of those clinics, some of them are not accredited by SHA to charge and get their payment from government. That means they will lose their money, they will lose their income, and that's how they will not sustain their businesses, because they have to buy medical supplies, non-pharmaceuticals, and also pay their staff, and also like make profits and make some money in that way. So they have a big roll, junk of booklets having patient names, and when the patient comes, you know, I've seen in small clinics